About 200 members of the Latinx community here in Baltimore received their second dose of COVID-19 vaccine.
Yeah, it was part of the state's efforts to improve vaccine equity and reach people who need it the most. WMER2 News' Ray Strickland reports on the partnership with faith leaders and their role in vaccinating vulnerable communities.
The state's rollout of the COVID-19 vaccine shows glaring racial disparities in distribution. So far, 1.5 million people have received their first dose in Maryland, but majority of them, about 65%, have been white, a number far outpacing minority communities who are being vaccinated at a rate much lower.
I don't know anybody who's hesitant about getting vaccine in the Latino community.
And at Sacred Heart Church in Baltimore, that proved to be true.
When we pulled up, we saw a line out the door.
The state's Vaccine Equity Task Force partnered with Johns Hopkins and church leaders to open a vaccine clinic. We couldn't shoot video inside due to privacy concerns, but the clinic helped at least 200 members of the Latinx community receive their second dose of the vaccine.
What we know to be true is that if we make it accessible, if we make it easy, if we bring it to the community, people will come.
The head of the Equity Task Force, National Guard General Janine Burkhead, says faith-based institutions are critical in getting vaccines to underserved communities.
It's important that we build the capacity and then continue to build the relationship so we can get into the community to that last person who cannot get out of that bed to get their shot. And that's what we're building by doing these community-based clinics where we're building trust.
And by building trust, the state is hoping to get shots into arms of more people who desperately need them.
This is how we're going to close these gaps, and this is how we're going to make sure everybody in our state gets this vaccine.
In Baltimore, I'm Ray Strickland, WMAR2 News.